Hi everyone, welcome back. So far in this module, we have discussed the healthcare system in India and the emerging role of digital health in improving patient care. Now we will be in module 2, part 3. Let us get started. In this part 3, we will explore digital health as a solution to tackle India's healthcare challenges. We will also discuss various digital health tools and technologies, their role in improving accessibility, efficiency, and quality of care. Also, look at the critical role of nurses in adopting and implementing these technologies. Let us cover each of these topics in detail. We will learn about digital health as a solution to tackle India's healthcare challenges. We have already learned about the challenges in India's healthcare delivery system, and also we have learned about digital health and its advancement in all other fields. So let us analyze whether digital health can solve these challenges. These are the examples of digital health solutions addressing the key challenges of the Indian healthcare system. We will discuss all these points one by one. Lack of awareness can be overcome by using mobile health apps such as Arogya Setu and SMS services to share reliable health information, helping people in the underserved areas to identify health issues better. Inequity in access to care can be addressed through telemedicine and digital consultations, enabling patients in remote areas to connect with healthcare providers online, reducing the need for travel. The resource shortages can be mitigated by implementing health management information system and electronic medical records to optimize the allocation of limited resources. Lack of affordability can be reduced by integrating insurance coverage. Digital health adoption of the hospitals attracts more insurance coverage from government as well as private insurance companies, which will reduce the out of pocket payment of the patients. The shift in disease burden, that we have seen that there is a shift in disease burden from communicable diseases to non-communicable diseases. This can be managed through chronic disease management apps that allow to track the vital signs, manage medications, and communicate with the provider. Let us learn about the role of nurses in digital health adoption. Let us ask ourselves, can these digital health tools like telenursing and mobile health apps empower nurses to deliver better care? As we all know, nurses are the forefront of healthcare delivery, whether in managing healthcare operations or providing clinical care. A significant portion of the healthcare burdens relies on nurses, making their contribution indispensable. While digital health acts as an enabler to address existing challenges in the healthcare system, nurses are crucial in adopting and integrating digital health solutions into everyday practice, ensuring that these tools are effectively utilized to enhance patient care. The role of nurses in digital health adoption includes data entry and verification, the telenursing, integration with healthcare delivery systems, patient education and support, the remote care, supply chain management, data collection and management, data privacy and security. Here we are discussing the role of nurses in data entry and verification using digital health. Nurses, as primary users, are involved in recording and maintaining medical records, example by using electronic medical record system. Nurses utilize EMR systems to track patient outcomes, monitor progress, and identify opportunities to improve care delivery. For example, if a nurse enters incorrect medication details into a patient's electronic medical record, later, when the patient submits a claim to their insurance provider, the mismatch in records causes the claim to be delayed or rejected. This can lead to patient dissatisfaction and additional administrative burden on the hospital. Telenursing refers to the delivery of nursing services and care remotely using telecommunication technologies. Nurses facilitate telehealth visits by preparing patients, providing remote assessments, and offering follow up care through video consultations or phone calls. They help bridge the gap between patients and physicians in virtual care settings. Integration with healthcare systems. Nurses play a critical role in coordinating with other healthcare providers to integrate digital health tools seamlessly into existing workflows. Nurses oversee patient vitals, detect fall risks, and respond to alerts in real time, especially in critical care units, ensuring timely interventions. With early warning systems, nurses can monitor patients, detecting signs of deterioration and early to prevent complications. For example, a nurse in the ICU uses a point of care testing device to monitor a patient's blood glucose level in real time. The results are instantly integrated into the hospital health records, allowing the doctor to adjust the patient in insulin dosages promptly. Nurses use digital health platform to educate patients about their health conditions, treatment plans, and wellness strategies. A nurse uses a digital health platform to explain to a diabetic patient how to use a continuous glucose monitoring system. The nurse shows how the device tracks blood sugar levels throughout the day and helps to notice the pattern and also alerts them to high or low readings on his mobile so that an emergency action can be taken. Nurses use digital tools to monitor patients' health remotely, such as through wearable devices, mobile apps, or telemedicine platforms. They can track vital signs, symptoms, and chronic conditions and intervene when necessary. For example, a nurse who utilizes remote patient monitoring to oversee a patient admitted with hypertension in a subcenter. The patient is provided with a digital blood pressure monitor that transmits the readings directly to the central healthcare facility. From there, the nurses monitor these blood pressure of the patient. Nurses also use digital health platform to manage inventory, to track the hospital supplies. We can use online ordering systems integrated with inventory software to place supply orders directly. We can track the progress, thus improving efficiency and reducing manual errors in ordering process. For example, a nurse can regularly update the inventory system to track the essential supplies such as IV fluids and medications. Ensures that there is no shortage of these drugs in ICU. The system generates alerts when the stock levels fall below the threshold, prompting nurses or other healthcare staff to reorder the supplies before they run out of the supplies. Nurses assist in collecting and analyzing patient data from digital health tools. This data helps in making evidence based decisions, improving care plans, and enhancing patient outcome. A nurse who uses a digital audit tool to analyze patient data in a hospital ward, identifying the trends in medication error. Based on these findings, the nurse implements a quality improvement initiative, such as a double checking high risk medication, a reducing errors and improve patient safety. And these type of digital audit tools can be used in all aspects of healthcare. Data privacy and security. Nurses use practices to protect data privacy and steps to ensure data security. Here, a nurse who implements steps such as securing password and uses two-factor authentication to ensure that the data is not accessed by others without a patient consent. Let us summarize this model and what we have learned so far. India's healthcare system has evolved from ancient practices to a blend of public and private providers, strengthened by initiatives like Ayushman Bharat. However, several healthcare challenges persist, which include infrastructure gaps, urban rural disparities, rising non communicable diseases, and a shortage of healthcare workers, particularly in rural areas. India still lacks in key healthcare indices like doctor patient and nurse patient ratios, emphasizing the need for a solution to bridge this gap effectively and immediately. Digital health is emerging as a game changer, addressing the challenges in accessibility, affordability, and resource gaps in India's healthcare system. Nurses, as frontline caregivers, play a vital role in adopting these technologies to enhance patient care and streamline workflows. The future of healthcare in India lies in bridging existing healthcare gaps through technology driven digital health solutions and skilled healthcare professionals. These are some references to build up on the topics discussed on this module. You can expand on what we have discussed today with the help of these references. Thank you for tuning in. Well done on completing Module 2 and Part 3. Keep learning and applying these insights in your practice. Your role in shaping the future of healthcare is very valuable. Stay curious, stay engaged, and get ready to dive into the next modules where we will explore even more ways to enhance patient care through digital health.